Good day! So, into our previous video, we talked about coryza. So now we will be discussing about influenza. Influenza, commonly referred to as flu, is an infectious viral disease caused by RNA viruses of the family Orthomyxoviridae, the influenza viruses. There are four types of influenza virus: type A, type B, type C, and type D. The type A virus is capable of infecting animals, although it is more common for people to suffer the ailments associated with this type of flu. Wild birds common act as the host for this flu virus. Type A flu virus is constantly changing and is generally responsible for the large flu epidemics. Type B flu is found only in humans. Type B flu may cause a less severe reaction than type A flu virus, but occasionally, type B flu can still be extremely harmful. Influenza type B viruses are not classified by subtype and do not cause pandemics. The influenza C viruses are also found in people. They are, however, milder than either type A or B. People generally do not become very ill from the influenza type C viruses. Type C flu viruses do not cause epidemics. Type D primarily affect cattle and are not known to cause infect or cause illness in people. Although there is concern that it could become an emerging disease threat for cattle workers in the future. These viruses are airborne and therefore spread in the air by coughing or sneezing, ejecting approximately 500,000 virus particles. Transmission generally requires close contact between source and recipient person because droplets do not remain suspended in the air and generally travel only a short distance. Contact with contaminated surfaces is another possible source of transmission, as the virus can live in non-porous surfaces for up to 48 hours and on clothing for up to 12 hours. When influenza virus is introduced into the respiratory tract by aerosol or by contact with saliva or other respiratory secretions from an infected individual, it attaches to and replicates in epithelial cells. The virus replicates in cells of both the upper and lower respiratory tract. Viral replication combined with the immune response to infection lead to the destruction and loss of cells lining the respiratory tract. As infection subsides, the epithelium is regenerated, a process that can take up to a month. Cough and weakness may persist for up to 2 weeks after infection. Who are at risk? Age. Seasonal influenza tends to target children 6 months to 5 years old and adults 65 years old or older. Living or working conditions. People who live or work in facilities with many other residents, such as nursing homes or military barracks, are more likely to develop the flu. People who are staying in the hospitals are also at higher risk. Weakened immune system. Cancer treatments, anti-rejection drugs, long-term use of steroids, organ transplant, blood cancer, or HIV or AIDS can weaken your immune system. This can make it easier for you to catch the flu and may also increase your risk of developing complications. Chronic illnesses. Chronic conditions including lung diseases such as asthma, diabetes, heart disease, nervous system diseases, metabolic disorders, an airway abnormality, and kidney, liver, or blood disease may increase your risk of influenza complications. Race. Native American people may have an increased risk of influenza complications. Aspirin use under age 19, people who are younger than 19 years of age and receiving long-term aspirin therapy are at risk of developing race syndrome if infected with influenza. Pregnancy. Pregnant women are more likely to develop influenza complications, particularly the second and third trimesters. Women are more likely to develop influenza related complications up to 2 weeks after delivering their babies. Obesity. People with a BMI of 40 or more have an increased risk of flu complications. The presentation of influenza virus infection varies. Patients with influenza who have pre-existing immunity or who have received vaccine may have milder symptoms. Onset of illness can occur suddenly over the course of a day, or it can progress more slowly over the course of several days. Typical symptoms include cough, sore throat, headache, fever, chills and sweat, vomiting, and diarrhea, muscle or body aches, runny or stuffy nose, fatigue. Cough and other respiratory symptoms may be initially minimal but frequently progress as the infection evolves. Patients may report non-productive cough, cough-related pleuritic chest pain, and dyspnea. In children, diarrhea may be a feature. Fever may vary wildly among patients, with some having low fever and others developing fever as high as 100 degrees Fahrenheit. Some patients report feeling feverish and feeling chills. Sore throat may be severe and may last 3 to 5 days. The sore throat may be a significant reason why patients seek medical attention. Weakness and severe fatigue may prevent patients from performing their normal activities or work. Patients report needing additional sleep. In some cases, patients with influenza may be bedridden. Complications. If you are young and healthy, the flu usually isn't serious, although you may feel miserable while you may have it. The flu usually goes away in a week or two with no lasting effects. But children and adults at high risk may develop complications that may include pneumonia, dehydration, ear infection, myositis, pericarditis, or worse in long-term medical conditions. Laboratory diagnostic procedure. Viral culture results do not yield timely results to inform clinical management. Shell viral tissue culture results may take 1 to 3 days, while traditional tissue cell viral culture may result take 3 to 10 days. However, viral culture allows for extensive antigenic and genetic characterization of influenza viruses. The collection of some respiratory samples for viral culture is essential for surveillance and antigenic characterization of new seasonal influenza A and B virus strains that may need to be included in the next year's influenza vaccine. Serology. In order to overcome the expensive and time-consuming obstacle of culturing, several serologic tests have become available. In reality, many of these are not bedside tests. Generally, 30 to 60 minutes are required to perform the test multiple steps. Test sensitivities generally range from 60 to 70%. The rapid influenza diagnostic test are an antigen detection assay that can detect influenza viral antigens in 10 to 15 minutes with moderate sensitivity and high specificity. Reverse transcription polymerase chain reaction. Testing of nasopharyngeal throat secretions is the criterion standard for confirming influenza virus infection. It is the only in vitro diagnostic test for influenza that is cleared by the FDA for the use with lower respiratory tract specimens. Immunofluorescence. Immunofluorescence assay are an antigen detection assay that generally require use of a fluorescent microscope to produce results in approximately 2 to 4 hours with moderate sensitivity and high specificity. Both direct and indirect fluorescent antibodies staining assay are available to detect influenza A and B viral antigen in respiratory tract specimen. Subtyping or further identification of influenza A viruses is not possible by immunofluorescence assays. Rapid molecular assay are a new type of molecular influenza diagnostic test to detect influenza viral RNA or nucleic acids in upper respiratory tract specimen in approximately 15 to 30 minutes. One platform uses isothermal nucleic acid amplification and has high sensitivity and yields results in 15 minutes or less. When a person has flu, it is essential that they take rest, consume plenty of liquids and healthy foods, stay at home, avoid alcohol, and stop smoking. For prevention, influenza vaccines, also known as flu shots, are vaccines that protect against infection by influenza viruses. New versions of the vaccines are developed twice a year as the influenza virus rapidly changes while their effectiveness varies from year to year. Most provide modest to high protection against influenza. The Centers for Disease Control and Prevention recommends annual flu vaccination for everyone aged 6 months or older. The flu vaccine can reduce your risk of the flu and its severity and lower the risk of having serious illness from the flu and needing to stay in the hospital. Ways in controlling the spread of infection. The influenza vaccine isn't 100% effective, so it's also important to take several measures to reduce the spread of infection, including washing your hands. Washing your hands often with soap and water for at least 20 seconds is an effective way to prevent many common infections. Or use alcohol based hand sanitizers if soap and water aren't available. Avoid touching your face. Avoid touching your eyes, nose, and mouth. Cover your coughs and sneezes. Cough or sneeze into a tissue or your elbow, then wash your hands. Clean surfaces. Regularly clean, often touched surfaces to prevent spread of infection from touching a surface with a virus on it and then your face. Avoid crowds. The flu spreads easily wherever people gather, in child care centers, schools, office buildings, auditorium, and public transportation. By avoiding crowds during peak flu season, you reduce your chances of infection. Also, avoid anyone who is sick. And if you're sick, stay at home for at least 24 hours after your fever is gone so that you lessen your chance of infecting others. Medical management. Antiviral drugs can treat flu illness. Antiviral drugs are different from antibiotics. Flu antivirals are prescription medicines and are not available over the counter. Antiviral drugs can make illness milder and shorten the time you are sick. They also can prevent serious flu complications, like pneumonia when treatment is started early. It's very important that antiviral drugs be used early to treat people who are very sick with flu. For example, people who are in the hospital, and people who are sick with the flu and have a greater chance of getting serious flu complications, either because of their age or because they have a high-risk medical condition. Other people also may be treated with antiviral drugs by their doctor this season. Most otherwise healthy people who get flu, however, do not tend or need to be treated with antiviral drugs. Amantadine and rimantadine inhibit the replications of the influenza A virus by blocking the viral M2 protein ion channel established by influenza A to allow virus to fuse with the cell membrane and enter the cell. Nursing diagnosis. Ineffective airway clearance related to pneumonia. Nursing management. Auscultate the lung fields for the presence of wheezes, crackles, rhonchi, or decreased breath sounds. Monitor patient for cough and production of sputum, noting amount, color, character, and patient's ability to expectorate secretions and the ability to cough. Position patient in high folders or semi-folders position if possible. Administer bronchodilators as ordered. Perform postural drainage and percussion as ordered. Encourage fluids up to 3 to 4 liters per day unless contraindicated. Nursing diagnosis. Hyperthermia related to exposure to infection. Nursing management. Monitor vital signs, especially temperature, every 2 to 4 hours and as needed. Utilize the same methods of temperature reading with each measurement. Administer antipyretic as ordered. Provide tepid sponge bath. Encourage increased fluid intake to 3 to 4 liters per day unless contraindicated. Monitor intake and output every 2 to 4 hours, and notify physician if temperature increases that do not respond to any measure used. Prognosis. Influenza's effects are much more severe and last longer than those of the common cold. Most people will recover completely in about 1 to 2 weeks, but others will develop life-threatening complications, such as pneumonia. Thus, influenza can be deadly, especially for the weak, young, and old, those with compromised immune system, or the chronically ill.